Hello,
Good morning.
good morning.
How are you?
I'm good, and you?
Yeah, I'm good. I noticed that you have been trying to join the meeting before 4 minutes. I'm sorry I couldn't join.
No, it's fine, it's
But
fine.
yeah, but thanks God because you are always on time.
Yes,
Okay. So I think today, Joel, we are going to finish discussing part B, and absolutely tomorrow we are going to try to finish part C. So this is it. After that, absolutely, we have to start discussing reading. I'm trying the best to cover all the sections, and I know that you are in a hurry, so this is why I'm trying just to do the things faster than before. Okay,
okay,
let me tell you that till now you are really amazing at listening because your listening skill, it's really good. But it's not the end because we have to complete listening to the not only part B, but also part C, because the listening section is about three parts. Not only the listening section is about three parts, but even the reading section is about three parts too. The first kind of questions you have to be careful was about gist. So we have to listen to the main meaning of the speakers are going to talk about. This is the number one, which is about gist. Now, two,
yes,
two is talking about details. Now, this kind of a question, the detailed questions, is talking about a specific part of the recording. The detail asked for is often one of the central ideas of the recording, rather than a more trivial piece of information. So we are going to hear the information that allows you to answer the question, but the question may or maybe not use the actual words that are spoken in the recording. So you have to be careful. Let's try to read the following list information just to give us examples about the detailed questions. So we can ask ourselves all the time that what would have improved the trainee's performance. And for example, I have to say that the patient's medication has changed because just to complete answering or finding the answer, because this is about details. And the next question is about what strategy does the surgeon suggest? Absolutely, we are going to practice. So let's try to listen to this recording, which is track 8. Absolutely, before listening to the recording, I'm going to give you 15 seconds just to read the information. So this is it. I cannot show you all the screen, so let me go down immediately to the multiple choice. Absolutely, the speaker is going to tell you what about the recording. And not only this, be careful that you have to finish reading all the information before the speaker is going to start, and you will hear the beep listen before the starting of the recording, okay?
okay, okay.
Okay, amazing. Absolutely, we have to finish reading all the information before listening to the recording. So let me play track 8, and please listen carefully. So this is track 8.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay. So does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
So this is the question about details. What do you think, Joel?
I also think it was between A or B, but I would choose A.
Yeah, exactly. This is A. Absolutely. The main or the detailed information is about transmitting voices more clearly than any other voices, any other noises or voices. Exactly. So this is it. The cochlea absolutely is in the inner ear. So exactly, this is the correct question. Now it's not the end because we have to listen to the second recording just to check and select the best or the correct multiple choice. So I'm going to show you the multiple choices before starting the recording. Okay, so that's amazing. Now let me start the recording, but let me mute myself because I don't want to interrupt you or something like that.
You hear a GP talk about type 2 diabetes mellitus.
Hello, I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
So this is about this question. Now, what do you think about the correct multiple choice?
I think it's B.
It's B. Okay, let's say that it's B. By the end of practicing, I'm going to show you the correct multiple choice. By the way, the correct answer is C. It's not they are not talking specifically about taking or carrying out this procedure twice, because the
But
main meaning.
she also didn't mention anything about the rest of the day. No,
Yeah.
being able to eat.
You know what I suggest to show you the words of the recordings. It is track 8. Okay, I know that sometimes it is a little confusing. Let me go down to track 8 to check the words that are said in this recording. And I suggest to play the recording and try to read while listening. This is really better. So this is exactly about this recording. Let me check out. I think, yeah, this is it. Okay. Yeah, I think now this is absolutely from this point to this point. Wait, let me check. Okay. Absolutely, the recording is about this one. Let me try to specify. You know what? I think we have to repeat the recording just to check the correct multiple choice. Let me do so. This is it. Let me go back a little bit and let's listen again.
Hello, I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use.
Wait, I think,
It's A.
yeah, this is it, exactly. This is exactly the second part of recording 8. This is it. Okay, so let's keep listening.
Hello, I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
Okay. I know, Joel, that he mentioned that twice. Wait, let me try to check this again. And I know that she said that 8 hours before they can take the test. And the next time they said that, let me try to read fast just to confirm. Okay. Convenient, carry out. This is it. Wait. Blah, okay, tests. Okay. This is number 1. Normal 70 billion, Bill mind. This is it. Okay. We noticed that in the beginning, she said that she is talking about the second type of diabetes. Am I right?
Yes.
Okay. I know that she mentioned that it is about before 8 hours. Absolutely, we don't have to eat anything in the morning. But we noticed that because it is about the second type, and in the beginning, she talked about the first one. But we noticed at the end that she said, because the main is about the second one. The second method we can use is to measure the average glycemia, for example, load over the past 3 months. So this is the main meaning of the recording. Okay?
Okay.
Yeah, this is 3 tests. Okay, so this is exactly the correct answer. This is about detailed information. By the way, at the end of practicing, I'm going to show you the correct answers. Okay, so this is about detailed question. Now I think we have to go up just to complete discussing the types of the questions in part B. I think it is 2. This is it. Okay. Now 3 is talking about speaker purpose. So in the speaker purpose question, we notice that the speaker purpose questions ask about what one of the speakers is doing or maybe trying to do. To answer these kinds of questions, we need to understand why the speaker is saying what they are saying and what result the speaker is aiming or maybe meaning or aiming for. The following list gives examples about the speaker purpose. So the questions or the question that I should ask, for example, what does he or she want to know about his or her treatment? Now, if I want to answer, for example, I have to say that the doctor explains that the practice should teach, I have to complete absolutely. And I have to say, for example, the trainee is trying to understand this and this. So we have to check the purpose the speaker means. This is the kind of the question number 3. Now, absolutely, we have to practice that by listening to recording number 9. And I'm going to show you the question. So the recording is going to talk about chipped tooth. Okay, let me give you 15 seconds maximum just to try to take a look at the multiple choices before starting the recording.
Okay.
Okay, so let me play it, which is recording number 9.
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. That's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
So what is the purpose of the speaker?
It's A. How long the procedure will last?
How long the procedure will last. Okay, I'm going to show you the correct answers, but I think I have to do so by the end of the meeting. Okay, so you said that it is number A.
Yes.
Okay, I think, you know what, I think I have to show you the correct answers, and if you want, I can show you the words about the recordings. Yeah, this is the second one. Okay. Oh, let me go up a little bit just to show you the first one. Okay. We notice that here it is talking about to allow the patient to eat during the day, because it is checking about 3 months ago of the food the patient ate during 3 months. So this is C, to allow the patient to eat during the day. And the next one is, wait, let me go down. Okay. And the next one is what her different treatment options are. Because we notice that the dentist is talking about the solutions that the girl has. Because she said in the beginning that it is, let me say that, quite expensive. Let me, you know what, I think I'm going to show you the recording just to be able to check the speaker's purpose.
In the beginning, they said no. They talked about other options, and this one is the best.
Oh, yeah, exactly. So they are talking about what? Solutions or options? Am I right? Wait.
Best.
Wait, I suggest just to go down to, this is it, exactly. So we notice that the recording is saying that, okay. So we've talked about the different options, and it seems like a veneer would be the best treatment. So given the cost of the procedure, are you happy to go ahead? She said that it is really quite expensive, but I definitely need my tooth to be fixed. So will it say what, or will it stay, sorry, but veneers tend to need replacing every 10 or 15 years, so long-term solution. This solution is really the best, and it will certainly be more durable than composite bonding. So this solution is better than the solution, and it will look more realistic too. So you notice that the dentist said that this solution is the best. So she said that, okay, that's great. And is there anything I can do to extend their life?
Yes,
Like,
they were talking, you know, a day it can last, how she can improve. That's
yeah.
why I said A.
But do you think this is the purpose of the speaker?
Because
Yeah.
in the beginning, they said that they already talked about other options.
But they are completely talking about
They didn't,
options.
yes, and they didn't mention anything. You know, they mentioned once the composite.
Yeah, okay, once. But what about the dentist when he said that this is the best solution than the second one? Am I right?
I don't. Okay.
And notice that she said, or he said, by saying, well, you need to maintain food, oral health, brushing. I know that he's talking about this, but it is not the purpose is speaking. So you should avoid brushing too hard, for example, just for this solution, because this solution lasts for 10 to 15 years. Okay, Joel?
Okay.
Okay. Okay. Let me now go up just to stick with the question. And we have to complete no, we haven't started practicing yet. Okay. So speaker's purpose, where is it? This is 4, this is 3. So this is about the speaker's purpose. Absolutely, we have to listen to the purpose of the speaker. Okay, now we have to complete listening to the question again, which is talking about the purpose of the speaker. So let me show you the multiple choices. Try to take a look at them before listening to the recording.
Okay.
Okay, so let me play the recording and please listen to the purpose of the speaker.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
So this is,
It's C.
it is C. Thank you so much. So it is not improving his condition by saying that I did this, yes, I did this, I wore the shoes, but there is no progress. Exactly, thank you so much. It is correct, which is C. So this is what I mean by listening to the purpose of the speaker, because exactly this is the kind of the question. Now, number 4, we have this kind of questions, which is about the function. The function questions ask about what one of the speakers is doing or what function of what they are saying is. Now, to answer these kinds of questions correctly, we need to understand the actions that their language describes. So absolutely, we have to ask ourselves these questions just to answer the function question. The first question, for example, is saying, what is the dentist doing, for example? And why has the patient called the doctor for what? Absolutely, we have a practice about function questions. Let's listen to this recording and let's try to check the function of the speaker or recording. Let me show you the multiple choices and let's listen to the recording.
Okay.
Okay, so let me play it, which is number 10.
You hear a doctor talking to a patient in an emergency department.
Hello again. I'm Dr. Oliveira. I think we met earlier at the beginning of my shift. How are you doing now, Mrs. James?
I don't really know what's going on. I'm just hoping to find out what's wrong with me.
Okay, Mrs. James, I understand, and thank you for waiting. They've run the tests, and they think you've got a condition called pseudomembranous colitis. It's a long way of saying you've got an inflamed colon. You've been waiting so long here in A&E because you're going to need a side room because of the infection risk.
Oh, dear. Okay, thank you for telling me. How long will it be till I get a room? And is it serious?
Well, at the moment, Mrs. James, we're operating on a one-in, one-out basis. But I do think that a side room will free up in the next few hours.
Okay.
The outlook is very good in most cases. We're going to give you antibiotics and fluids, but there is a small risk of the infection returning in the future.
So
A.
It is A, explaining how the patient will be treated. Am I right?
Yes. Yes.
Mm-hmm. Okay, absolutely. I'm going to show you the recording and the correct answer. So we said that it is 10. Let me scroll down to 10. So this is it. This is exactly the recording. Okay. And this is the correct answer. Right. Different treatment options. It's not improving, explaining how the patient will be treated. Exactly. So this is exactly number A, which is the correct multiple choice. So the correct one is explaining how the patient will be treated. You know what I suggest, just to keep showing the correct multiple choices and to scroll down step by step just to match your answers. So thank you so much. Now let me go up to the recording just to complete. So function. Okay, exactly. Okay, it's not the end because we have the second part of the recording. Okay, now let me show you this one, and please read the information before we start.
Okay.
Okay, so let me complete.
You hear a medical student talking to a senior resident about assessing a patient.
I understand that Mr. Frederick has chronic heart failure and that we're concerned with volume overload if he doesn't adequately excrete enough fluid. But how do we determine his volume status and whether or not he needs diuretic medications?
That is a good question. So there are several ways we can assess volume status. First, we can perform a physical examination on the patient. What would we be looking for?
Well, we can assess for peripheral edema. We would look at the patient's hands and feet to assess swelling and determine whether or not there is pitting.
Yes, very good. We can also assess for jugular venous pressure. This is most easily done by having the patient lay at a 45-degree incline and then observing his external jugular vein. The filling level of the jugular vein should be less than 3 centimetres above the sternal angle.
It's A.
Exactly, it's A. So she said that first we have to check the physical examination, then we have to do this, then we have to do this. Okay. This is about function question. I will try, as I told you, not to show all the answers, just to go down step by step, just to match the answers and to check if the answers are correct or maybe not. So this is the function of the question. We have to listen carefully to the speakers just to check the function. Now, the question number 5 is talking about opinion. Now, in opinion questions, absolutely, the opinion questions ask you to identify the opinion of the speaker on a certain issue. When answering these kinds of questions, we have to be careful about how the speakers say things and their attitude towards the topic of the question. Absolutely, to do so, for example, we can ask ourselves the questions about the radiographer, for example, thinks that the patient, and we have to complete, how does she feel or he feel about her or his role? And the nurse, for example, the doctor believes that the doctor or the nurse believes this and this. So now this kind of questions is talking about opinion. Absolutely, we have to practice, and let me show you the multiple choices before starting the recording. So these are the multiple choices. Take 15 seconds to at them just to before we start the recording. Okay, so this is a track 11. Let's play a track 11 and let's listen carefully.
You hear a psychiatrist presenting a case study.
Good morning, everyone. I would like to speak about a curious case that I was involved in last year. The patient was a young man who reported continued visual disturbances. What made this case so interesting were the changes he described to his visual field. Objects began to get larger and smaller as he looked at them. His father's face slowly morphed into that of a stranger, and he would see trails of light zigzagging across his field of view. These are uncommon for visual hallucinations. They are unlikely characteristics of a primary psychotic disorder, but they are akin to a psychoactive substance-induced hallucination. However, his urine drug screen was negative for any substances, and he reported that his last use of any hallucinogen was 3 months ago. We have found several case reports of hallucinogen persisting perception disorder, HPPD, and believe that this patient matches the criteria for such a diagnosis.
It's A.
It's A. The symptoms suggested a different case. Do you, okay. Let me show you the correct answer, teaching the student to wait. The patient, yes, we said this is it, affects were experienced long time after the cause. I think I have to show you the words of the recordings just to check the correct answer. This is 11. Okay. Now let's try to read and to check why the answer is B, which is the effects were experienced long after the cause. So I'd speak about curious case happened last year. The patient was a young man who reported continued visual problems, made interests, described visual field objects began to, this is number 1, began to get larger and smaller. Then his father faced slowly problem, then would see zigzagging or something like that. These are uncommon for visual hallucinations. Okay, but However, this is the second one. Okay, and her reports at his last use of any hallucination, for example, 3 months ago. So we had to find several case reports about these hallucinations. So we think that the answer is B, which are the effects that were experienced long after the problem or the cause.
Okay.
Exactly. So this is the opinion about the speaker. We have to check his opinion because sometimes the speaker is going to mention all the multiple choices. So we have to be careful by listening carefully to the opinion of the speaker. Let me go back to the kinds of questions. This is 12. I think this is 11 exactly. Now, the kind of questions, which is number 6, is talking about agreement. How the speakers are going to agree on a certain issue or idea. So agreement questions ask you to identify what the speakers are in agreement about. So to answer these questions correctly, we have to listen absolutely to the conversation and to check the reactions of each speaker in the recording. Now, to do so, we have to ask ourselves these questions about agreement questions. Now, the speech pathologist agrees that, so this is about agreement. And what do agree about? Absolutely, this is about agreement. Now, the psychotherapists agree that they will do this thing and this thing. So we notice that the speakers are going to agree about a certain issue or idea. This is agreement question. So we have a recording about that, which is track 12. But let me show you the correct multiple choices before listening to this kind of a question. Okay, now I think it's the time to play recording 12, just to check the correct multiple choice.
You hear a dietitian talking with a patient.
Okay, Mr. Weiss, so it looks like you haven't lost any weight this month. Do you have any idea why that might be?
Oh, really? I feel like I've been trying really hard to lose weight. In fact, I thought I would take it a step further in the past couple of weeks because I was a bit bad in the first week or so. So recently I've been trying to cut out all carbs and any junk food. You know, to be completely honest, though, I've wound up cheating on my diet.
Well, you need to stop being so strict with yourself. We designed your diet so that it would be achievable. When you try and do things too quickly and make too many changes to what your body is used to, it's difficult to maintain long term, and you end up overeating as a result. Also, I can't imagine that it made you feel good about your progress when you kept going off track.
No, it really didn't. I see what you're saying. I guess I need to be kinder to myself and be more patient with the slow and steady route.
Okay. It's B.
It's B, exactly. She said that you have to stop being strict. And he said that I have to be kind because he cut off all carbs. Exactly. So the correct answer is B. Thank you so much. The recording is about to be finished because we have less than 1 minute. So let's meet again and discuss the final kind of questions, which is course of action. And absolutely, we will practice a whole part A exam. Okay, so let's disconnect this meeting and come back again.